Consumer health. An introduction.
And in health, our topic is consumer health. Consumer health is intended for potential or current user of medical services, or all of us. It is designed to be educational and can help individuals make decisions about health-related behavior and medical treatment.
Summary of topics. Health consumers are people who use health services, as well as their family and careers. This would help people to choose what product they could potentially use the service in the future. Objectives. At the end of the activity, the learner should be able to 1. Differentiate reliable and unreliable health information, products and services. 2. Explain the guidelines and criteria in the selection and evaluation of health information, products and services. 3. Discuss the various forms of health services. Subject matter. 1. Consumer health. 2. Health consumer. 3. Health information. 4. Health products. A. Over-the-counter, OTC drugs. B. Cosmetic products. C. Hair care products. D. Oral care products. 5. Criteria for evaluating health information. What is consumer health? Consumer health is not just about buying health products and services. It also involves knowing the facts and having a deeper understanding that enable people to make wise choices. Health information, health products and health services are all related to bringing consumer health. Health information is important in deciding what health products and health services to acquire. Health service personnel are also sources of health information. These three factors are important to consider in consumer health. Who is a health consumer? A health consumer is someone who examines health information in products and services. The consumer is the one who purchases and utilizes the goods and services. What is health information? Health information is everything that is seen, read or heard in relation to human and community health. It could be in the form of print media, electronic and digital media. A wise consumer needs to carefully evaluate health information or else they will fall victim to fake or substandard health products. Knowing these information helps in choosing which can be trusted, which is fake or which advertisement is risky. It can also save money and time and safeguard the health of the consumers. What are health products? Health products includes medicines, medical equipment and related devices. 1. Over-the-counter OTC drugs. More than 500,000 of OTC healthcare products are available, varying from mouthwashes to pain relievers. Even some of the most beneficial OTC drugs can be unsafe. The following are examples of the risks of using these drugs. A. Pain relievers like aspirin and ibuprofen can harm the stomach lining and lead to ulcer, while large dosages can cause kidney damage. B. Acetaminophen used for fever and pain reliever for children, if taken in heavy doses, can cause bleeding and liver pain. These pain relievers should not be taken on an empty stomach. They must be taken with food and glass of water to avoid irritation to the stomach lining. C. Prolonged use of nasal sprays that relieve congestion can cause blood vessels in the nose to swell and can worsen congestion. This is called the rebound effect. It can also result to bleeding and loss of the sense. D. Frequent use of laxatives destroys flora in the intestinal tract, making constipation even worse. Exercise and high-fiber diet are safer alternatives for promoting normal defecation. 2. Cosmetic product. Many healthcare products are intended for external use. Some have little effect, but due to advertising campaigns and misconceptions, they are extensively used. A. Skin care products. OTC skin rejuvenation have never shown efficacy in changing skin properties. Moisturizers prevent the skin from drying for a limited period of time. Deodorants and antiperspirants helps control body odor, but no product can prevent sweating in extremely hot weather or during exercise. Sweating is the primary means of cooling the body. Regular washing is essential if the bacteria and other odor-causing substances are to be removed. B. Hair care products. Several products are designed to remove hair, like shaving. Tweezers used to pluck unwanted hair may present some danger of infection when adjacent skin is not clean. Chemical products are usually safe, but there is always the possibility of skin reactions, irritations and infection. A dermatologist should be consulted whenever symptoms appear. C. Oral care products. Oral products includes toothpastes, mouthwashes and gargles. Water supply containing fluoride also helps prevent dental cavities. It is unwise to purchase toothpaste with whiteners because they contain abrasive elements that damages the teeth. Mouthwashes and gargles do little to eliminate bad odor or treat a sore throat. Odors are carried from the intestine to the lungs and exhaled through the mouth. Bad breath may be symptoms of infections, tumors or diabetes. Excessive use of mouthwash can dry the mucous membranes, making the throat even more irritated.
Criteria for evaluating health information. Whenever you consider buying health products and services, ask yourself the following questions first. What? Content of the product. 1. Is there a list of content in the product label? Are the contents clearly? 2. Is the information up to date? 3. Does it indicate the side effect? Why? Purpose of the health information. Is the information provided to promote or sell a health product? Who? Source of information. 1. Who is the source of the information? 2. Is the source credible and trustworthy? 3. Is the source verifiable? Feedback or response. 1. Does the source of health information respond to comments and queries? 2. Do sources of information allow customers to give comments and feedbacks?
Do you consider yourself as a consumer? Is it important that you know your rights as a consumer? Well, today, we are going to discuss about consumer health. But before that, let's have an assessment first. Choose the letter of the correct answer. You are only given 10 seconds to answer each question. Let's begin with question number 1. What is consumer health? Consumer health aims to develop a person's ability to evaluate and utilize health information, products, and services wisely and effectively. Consumer health is an important thing that we should always consider. Well, today, we are going to dig deeper about consumer health. There are 3 things that we should remember when we talk about consumer health. Number 1, it's called health information. Number 2, health products. And number 3 is health services. Health information is information that people require to make wise choices and decisions about their health or the health of other people. This may also involve ingredients or raw material used, nutrition facts, directions of consumption, expiration date, serving amount, manufacturing company, prescribed consumer, and cautions. Now, always remember that information can come from a reliable and an unreliable source. It is important to identify information before accepting it. This information that we're about to accept can affect us, especially our health. Now let us try this activity. It is called Celebrity Bluff. If the information is true, answer fact. If it is false, answer bluff. First, sleeping with wet hair causes mental disorders. It's a bluff. Wet hair does not cause mental disorders. The factors for mental disorders include genetics, brain injury, exposure to toxins, and misuse of certain drugs. Putting toothpaste on burn causes irritation. Yes, it's a fact. Toothpaste has been suggested to ease irritation in burn. However, toothpaste can actually do more harm to your burn. Warts are contagious. It's a fact. Warts are contagious and can be transmitted with a skin contact with an infected person. They are highly contagious with a skin-to-skin contact. Touching hands of people with HIV may infect you with such. It's a bluff. HIV can only be transmitted by certain body fluids from a person who has HIV. These fluids include blood, vaginal fluids, and breast milk. Chocolates causes acne and pimples. It's a bluff. There are no direct evidences yet which tells that chocolates causes acne and pimples. Before accepting an information, make sure to assess if it is from a reliable source to avoid misleading informations. Now, we are done with health information. Let us proceed to the second one. It is called health products. Health products are food, drugs, cosmetics, devices, biologicals, vaccines, and in vitro diagnostic reagents. These are actually products that we use daily. These products may be purchased from various places like supermarkets, pharmacies, and hospitals. We have to be very careful in choosing products that we are going to use. Some products can actually bring bad effect to our health. So make sure that these products are approved by the Food and Drug Administration and the Department of Trade and Industry and other government or private agencies that approves products to be sold in the market. So choose products wisely. And lastly, health services. Health services are often connected to healthcare. These programs aim to appraise the health conditions of individuals through screening and examinations, cure and treat disorders, prevent and control the spread of diseases, provide safety, emergency care and first aid, and ensure a follow-up program for individuals who have undergone treatments. Choose a health service that is run by health professionals. We can't just trust anyone who can help us with our health problems. Do not submit yourself to persons who are not authorized or licensed to provide health services. Make sure to deal with people or health professionals who are capable of helping us when it comes to our health concerns. Now, let us talk on how to become a wise and well-informed consumer. This is a shopper's buying guide. Get to know the products and services first. Be meticulous with sales talk or marketing gimmicks. Consult the authorities when in doubt. Never sacrifice quality for quantity. And these are the criteria for consideration: safety, price, quality, and environmental impact. Now, do you know what kind of consumer are you? Are you an intelligent consumer that prioritizes your needs and limit your purchase on your ability to pay? Or are you a spendthrift consumer? Lavish spending, luxury, lost thrift or economy is in your vocabulary. Or are you a bargain addict? You are 100% obsessed to all types of sale. You're an easy prey to the sales trap played by deceitful traders. Or are you a close-fisted consumer? You hoard a lot of money but deprive yourself of your needs. Or are you a panic buyer? Because you are triggered by the following humors. Or do you consider yourself as an impulsive buyer? Shopping on a whim. Then, regret creeps in when the time comes to pay your bills. Or are you a wasteful consumer? Now, here are some examples of the rights and responsibilities of a consumer. First is the right to safety. Second is the right to be informed. And third is the right to choose. And now, let us talk about healthcare insurance. Health insurance is a financial agreement between an insurance company and an individual or group for the payment of healthcare costs. This may also pertain to protection benefits for sickness and injury. Some examples of healthcare insurance that we have in the Philippines is what we call the PhilHealth. We also have the MaxiCare.
Assess and learn. Consumer health. Prepare a learning log. This will help you integrate your knowledge, understanding and personal feelings about health products. Try making entries in your logs during the last 5 minutes of the presentation. 1. What did I learn about health products in the presentation today? 2. What did I find interesting about decision making in buying health products? 3. What feelings do I have about my learning on health products? 4. What questions do I have about how to become a wise consumer of health products?
So I hope you guys learned a lot from our lesson for today. See you on our next discussion.